happy to welcome back to the show our health expert, Dr. Poonam Alaigh, to discuss the early start to the allergy season. This mild weather in the United States, boy, we are paying the price with a surge in allergies. Am I right?
Yes, everything has a good side and a bad side, so absolutely, Laura.
All right. Well, what can you tell us about this allergy season in particular? Certain pollens, what's affecting people first and furiously?
Well, I think that the most important thing is to realize that the allergy season has actually started a month before it normally starts, and it's because of a twofold factor. One is because we've had somewhat of a less brutal winter, and so the time that it takes for plants and trees to go dormant has actually been reduced. And secondly, we've had an early start to spring. So now you see this beautiful rejuvenation and revitalization and all that happening in our plants and our trees. But at the same time, just like you said, we are paying a price. And we've started seeing patients actually as early as February coming in with really bad allergy symptoms and really difficult times that they're having.
Early start, does this mean that we'll be an early end or just an elongated allergy season?
You know, it's very difficult to say. We are getting prepared, and it does seem like we may have a prolonged allergy season with a higher peak levels of pollen count, and so it is important to be prepared and actually understand what you're allergic to and actually take precautions.
Well, how do you prepare? I myself, knock on wood, except when I was pregnant, I've never really, suffered from allergies. How do you prepare? How do you
you're
protect?
Lucky, Laura, because I tell you, the folks that suffer from allergies, it is so difficult.
Miserable.
Because you have to keep functioning, but at the same time.
How do you prepare and protect then?
One of the most important things is actually to see a physician to identify what your allergens are. Around the springtime, it's usually the tree pollen that one gets allergic to, and then in summertime, it's usually the grass pollen, and then over the fall, it's usually the weeds. And
is it an easy test to determine what you're allergic to?
It is fairly easy. It could either be a skin test or a blood test. Once you identify what your profile is, again, the most important thing is to take precautions. And the first thing is really to be able to make sure that you're exposing yourself to the least amount of pollen or allergen. And one of the ways of doing that is really staying indoors, air conditioning, less heat, less humidity. If you must go out during the height of the allergy season, do it early in the morning or later in the evening. With the kids now, I know that's an issue.
Oh yeah, they want to play outside.
They want to play outside, but as soon as they come in, if in the laundry room or something, you can change their clothes and put them into the shower and wash their hair. That's going to be very important because pollen tends to stick to the hair.
Is there a difference in treating children as opposed to adults and precautions we need to be careful with when it comes to allergies?
It's actually somewhat similar. It's important to stay away from the allergen. Again, change things at home, not too much of carpeting, bedding, stuffed furniture.
Do a lot of vacuuming and dusting.
With HEPA filter, because that helps to clear away. Humidifiers. Make sure if you have pets, you know whether you're allergic to pets and how you're going to be dealing with that. Also speak to your physician in terms of some medications. Most important thing is taking care of your stress. Make sure, I have to tell you, that's the #1 reason why the allergies come on so strong.
It exacerbates.
Absolutely.
See your doctor, ask questions, and take the medicine and do what they say. Doctor, thank you so much for your insight and analysis. We appreciate it.
Thank you. Enjoy the summer.
All right. We will. I love the summertime.